Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I created my channel with the hope of sharing all my stories, my tips, my tricks about medical coding with all of you. So if you want more content, I hope that you'll hit that subscribe button. I hope that you'll like this, and at the end of this video helps you, I hope that you will share it. So let's get started. All right, what is Q&A Tuesday? Q&A Tuesday is the #1 question and answer show about medical coding, airing on Tuesday. I take all of the questions that were submitted from viewer comments, through emails, through Instagram, and I put it all into one episode. If you want your question answered for next week's Q&A Tuesday, I hope that you'll comment below. And a huge shout out to everybody who submitted a question. All right, let's get started. First question. I have a question. I was going to sign up for coding, but in your last video, you say that it is hard to do coding. And now that makes me scared a little. Do you think that it is hard to start a coding class? So I always say that yes, medical coding is difficult, but it's not impossible, and don't be scared. I always say the don't be scared part whenever I say that it is difficult. Somehow this part always seems to get left off because people hear that it's hard. The thing is, guys, I want you guys to understand what you're getting yourselves into. A lot of times when people are getting signed up for these medical coding programs, they're seeing the rosy side. They're seeing all the good things because these recruiters have a job. Their job is to recruit people. Now, if you start telling people it's a lot of reading, it's a lot of work, you're not going to get people very interested and excited about medical coding, right? Because they're going to tell you the good things because they want you in there. They want you in that program. And they have quotas they got to meet too. So you got to think about that. Now, I am giving you guys the real talk. When I tell you that it is difficult, it is not impossible to learn it. Don't be scared. I always say that in the same sentence. So hear me when I say, don't be scared. These things, yes, it's going to be a lot in the beginning. You're going to question yourself. You're going to be like, well, I didn't have any experience in medical, and I didn't go to college. Guys, this is the thing about medical coding. All you need to start is a high school diploma or a GED to get into a program. And at that, you don't even have to go through a program. You can study on your own. Now, what does this say about medical coding? That if you study, you can do it, right? You can independently study. People do it all the time. They never go through a program and they're able to be successful at their careers. The thing is, anything worth doing is worth applying yourself. You have to apply yourself. If it was easy, then everybody would do it. All right? So think about that. Don't let what I say scare you off. It should prepare you for what is to come. Now, I'm telling you these things because I wish somebody would have told me. Now, I am naturally a reader, so I study. This does not scare me. Like to study and to learn, that does not scare me. People start to overthink, and that's what scares them. So if you're interested in this, and this is something that you want to do, go for it. Don't let all this other external stuff start to scare you, because when you start overthinking, that's the thief of dreams, okay? It is a thief of dreams when you start to overthink. So this comment from this viewer of now she's starting to second guess herself, don't second guess yourself. If you want to do it, do it. But be prepared that it's work. It's not going to be something that's easy, and it's definitely not going to be something that's handed to you. Now, like I said, I say these things to prepare you guys, not to scare you off. Next question. As I have medical background, will this be easier for me? Now, I have seen nurses who have struggled to learn medical coding. And I've seen CNAs struggle to learn medical coding. If you have a background in medical, like your anatomy, physiology, medical terminology, it is a lot easier to get into this, like as far as learning it, than somebody who has no previous background at all. But I have seen people with medical background struggle to understand what we do as medical coders. It's the rules and it's the coding that gets people a lot of the times, because you have to look at documents and you have to be able to understand the rules. So you have to be able to reason and do critical thinking when you're looking at encounters. And whether the encounter already has diagnoses that are pre-selected, sometimes these pre-selected diagnoses are not correct. So you have to make sure that you're looking through there and you're doing your reasoning and you're doing your critical thinking in order to be able to figure this out. But I will say that it will help you if you already have previous medical, like anatomy, physiology, and medical terminology, but it's not going to guarantee that you're going to understand it right away. So that is just something to be prepared for, okay? That's why I say when the viewer asks, will it be easier for me? It's not going to necessarily guarantee it, but it will help you, all right? Next question, is it a good career? I say this a lot. You're asking the most biased person in this industry. Is this a good career? Is medical billing and coding a good career? Absolutely it is. But that's my opinion. I really love what I do. And I share what I know and things like that because a lot of times I see that this was a missing part of being a medical coder, because there's stuff that you learn in school and then there's stuff that you learn in the real world, and there's the middle. And the stuff that you learn in the middle is what can make or break you as far as like whether you really enjoy what you do. I had my aha moment in my career in 2014. Now, had I always enjoyed being a medical coder? In the beginning, it was a job. It was a job for me. It was like, okay, I have a good job. And I never said career. I always said I have a good job. And, I was very good at it, But it wasn't until 2014 that the light bulb turned on. I'm like, ooh. And in 2014, when I started to do the weekend studying, and I started to go to conferences, and I started to apply myself more, then I started to really understand it. And then when I started to have to explain it, it was just like, it wasn't a struggle for me after a while, because I was just like, okay, if I start to read this and I start to read that, I can explain it. And when I was able to start explaining this to my providers, and I started to be able to explain this to other coders who were struggling to understand, then it was just like, oh, now the light bulb is on. And it's just like, ooh. And now here I am. And it wasn't until a couple of years ago I started doing my channel here on YouTube. And it wasn't until about a year ago, because I started it 2 years ago. And about a year ago was when I really started to get serious about YouTube. And now we are 5,000 plus strong currently. So thank you guys for that. And, to me, it is such a good career. It has changed my life. It has provided for me very well. And these are the things that I look at as terms of like, is this a good career? This is not something that I don't see myself stopping. Like, I don't think, oh, well, I'll do this for a little while and then I'll change to this, or I'll do something else or whatever. I don't really see that. And so to me, it is a great career field, but it's all up to you. However you choose to see things, because everybody can have a different opinion. And if you go to Facebook medical coding groups, like I tell y'all not to do, you'll see that many different people have different opinions when it comes to medical coding. And a lot of them, some can get very negative about medical coding, and they say, oh, it's not a good career field and things like that. So it just depends. I refuse to surround myself with negative people. Flat out refuse. In my personal life, in my work life, I refuse to have negative people, because everything is your environment has a lot to do with how you feel about a career. And if you have negative people around you, that can bring you down really quick. And I tend to absorb people's energy, and I can't. When I get around negative people, oh no, we're gonna exit to the left, because I don't deal with that. Period. And for me to enjoy what I do, I need to have that positive energy around me. I need to know what I'm around. And for me, it is very good. And I keep it that way because of how I choose to see it. So if you choose not to see medical coding as good, then that's what you're going to see. If you choose to see medical coding as a really good thing, then that's what you're going to see. And that's what I choose to see. I choose to see it as good. Is it hard work? Absolutely. Is it going to give you a challenge? Oh, yeah. But it's good. At least that's what I have to say about it. Next question. Will the job be too stressful as I have to manage kids at home? Okay, so we are dominated by women in this field. There are a lot of mothers in this field. Everybody else has kids at home. I do not have children, okay? But every person that I worked with when I first got to my location where I am now were mothers. I was the only one who was not a mother. Everybody had little kids. So if they could do it, and they had lots of children, they had 4 and 5 children, a lot of them. So they have lots of kids here, and you know, they were all able to do it. And so it's just going to depend on how you handle stress. Everybody handles stress differently. But I will say this, if you start to overthink about medical coding, that's where you're wrong. And that's where you got to work on that. The best thing that you can do to not stress yourself out when it comes to medical coding is to continue to study. Because the only time it gets stressful is when you don't know something, right? And if you feel lost, that is going to like add to that stressful feeling. But if you continue to read, you continue to study, and you're working in like a specialty clinic, and then you start to read more about it, then it's the reading what the doctor is writing is going to make a lot more sense to you. Okay, so don't see your family as, well, you know, I can't do something stressful at work because I have a family. It's you can have stress in any field, in any job, okay? But with medical coding, it's intellectual. That is what it is. And yes, we don't do a lot of physical labor. We may have to, you know, move records here or there, or move books around or whatever, but we don't do physical labor. But our work is more mental, and that is just as exhausting as physical labor. I know. Okay, because I've done physical labor before. I used to deliver phone books for a living, okay? But doing this is just as tiring. There are some days when I come home and I'm completely exhausted because I've been reading all day, or I've been having to do a class, or I've been having to explain something to somebody, and it just takes it out of you. But that's any career. So again, it's entirely up to you. And can it be stressful? Absolutely. But it's all up to you, and it's all on how you handle it. Next question. If it's okay, I'm planning to start with Career Step online course for coding. Career Step is a great program. I have never been through Career Step, but I have gone to conferences, so I have met the people who work with Career Step, and they have lots of really good programs. Like if you are looking for financial aid and things like that, they have a lot of those. They do accept a lot of those things. So if you're interested in that, you can check it out. They do prepare you for a HEMA or AAPC, which is really great. And that is something that you can look at. You can also look at going directly to the association websites themselves if you are looking for somebody to train you in medical coding. AHIMA and AAPC both have their online medical coding programs. AHIMA lets you have an entire year from the time that you pay. Now, AAPC is a little bit shorter, and they have different things for their online program. So be sure to check out the websites, and I will leave both links down in the description box below. I will leave the direct link for the AHIMA online course because it's a little to get to. That's the one thing. That's the one thing about the AHIMA website I see, that it is very difficult to get to their online medical coding program. It's like you have to kind of go in a little weird way, and I'll just leave you guys the link, okay? But yes, check that out, because a lot of times those are a fraction of the cost of going to an online trade school. I'm just saying. But yes, Career Step is great. Okay. Next question. Will it be typical 9-to-5 jobs types? Yes. We work full-time. If you are brand new, don't try to look for part-time work, because you won't find it. Part-time work tends to go, or PRN work goes for people who have had experience. If you don't have experience, they're not going to want to sit there and train you if you're trying to be a part-time medical coder, because they're not going to get a lot of production out of you, because you're going to have lots of questions. Well, Blue, I passed the test. I know how to code. Book coding and real world coding is two different things. So when you get into the real world, you will understand that. So I'm just saying, you will have lots of questions. Plus, everybody has a different electronic health record. They have different encoders. So there's all these other things that you have to learn. But yes, if you are looking into medical coding, and especially if you're brand new, look at it full-time. This is a full-time position, okay? Next question. You mentioned in one of your study tip videos to read cover to cover the Evaluation and Management book. Can you let me know that book? To be sure, is it the CPT book? I'm sorry for the questions. I just really want to succeed as much as possible and taking your advice on reading this cover to cover. Okay, first of all, don't apologize. Okay, you're asking a question. Never apologize for asking questions. Or if you have to ask somebody a question, never start with, I'm sorry. Or don't put that in there, I'm sorry. Don't put that in there because it's a question. And that is something that you got to learn because that's a habit that people have and they carry it into their career lives, right? And so when providers get around somebody who starts apologizing right away, they tend to lose their patience fast. So the thing is, be direct with your questions. Start now. Start now with your questions being direct, okay? You got to cut out all that I'm sorry stuff because you're not sorry. You're asking a question because you want to be sure. Now, evaluation and management. When I went to school was over 10 years ago. So my book is outdated, okay? And I can't even remember the name of it and it's in storage, okay? That's how with books I am. I still have my books, but they're in storage. Now, for evaluation and management, I will try to look some up and I will probably put it like in the community tab, okay? Like books that I recommend, or I might put it on my Instagram as well, like a picture of it. But those types of books that are specifically talking about evaluation and management, you can find a lot of them on often360coding.com, which is a great website that I have to stay away from because it's too tempting to always buy books from there. Anyway, so the CPT book is the outpatient procedures coding book, okay? There are the guidelines in there, but that's not the book that I was referring to read cover to cover. Do they have the evaluation and management rules in there? Yes. But again, that is the procedures book. So yes, while you can look through it, it's unnecessary to read the entire CPT book cover to cover. What I was referring to was a book specifically talking about evaluation and management. And like I said, I will leave some of my recommendations in either the community tab of YouTube or on my Instagram. Okay. Next question. Hey, Blue, my online school program says that it's preparing me to take the CPCA with AAPC or the CBCS offered by the NHA. What do you think about those? Should I get a refund? No. So when I tell you guys, when you're looking at medical coding programs, as long as they're preparing you for a HEMA or AAPC credentials, you're good. Now, this other one, the CBCS, nobody that I have seen looks for that, okay? That is for billing, but you don't even have to be certified to be a medical biller. That's number one. People think that you have to be certified for a medical biller, and yes, AAPC does have their CPB, which is a certified professional biller. Now, I will say about that, CPB is a good credential if you have your own business. If you have a business in billing, yeah, it would be good to have something like that on your name because at least it shows people that you're trying to get a contract with that, yes, you've had some sort of formal training along with some experience. And some people, experience is just as fine. But some people like to have that extra security of having credentials after their name. But if you are wanting just to be a medical biller and not have to go through all this process and this rigmarole of trade schools and things like that, just apply to be a medical biller. You don't have to have experience. That's the good thing about medical billing because there's just sort of training you, and all of the billers are doing is essentially processing paperwork. So that is what they're doing, and there is no formal training that is needed, okay? If you are wanting to be competitive as a medical coder, you have to be certified with a HEMA or AAPC. Now, if you don't believe me, check out the job listings for medical coders and you will see that employers are asking for a HEMA or AAPC credentials. Now, that CPCA, it just means apprentice. The CPC-A means apprentice, and that is something that is specific to AAPC, and they're just saying that with that A, that you are a brand new medical coder. Now, there is a time requirement in order to get that A removed. But once you meet that time requirement or whatever requirements they do have, you can get that A removed. There's many ways of getting it removed through work experience and through going through a program on their website called PractiCode that is a product with AAPC, and that is something that you can look at further on their website. But yes, that is totally fine going through an online program as long as they are training you for either a HIMA or AAPC. Okay. Next question. I am majoring in health information management. Is this the same as a coder? Or is it running a healthcare facility? That is running a healthcare facility. When you are in those degree programs, that is essentially what they are doing. They're preparing you for is being the captain of the ship. I have seen very rarely an RHIA or an RHIA, which is a Registered Health Information Administrator. I have rarely seen them be just straight coders, because that is essentially taking a huge step down. That is having them without using them at their full capacity. A RHIA is generally the captain of the ship. That is what they do. They're trained in the business side of the house. They're not really trained so much in the coding side of the house. Now, sometimes they may have the experience as a coder, so they can be, they sometimes use them to squash disagreements between coders. But for the most part, they are the captain of the ship, and that is what they do. And even with the degrees, a lot of times employers will still ask degree holders to get a regular credential like the CCS, which is a Certified Coding Specialist offered with the American Health Information Management Association. Okay, so next question, and the last question. Do you need experience in a doctor's office or a hospital before you can work at home as a medical coder or a biller? Yes, you do have to have experience before you can work at home. And a lot of people want to get into this and immediately say that they want to be, they want to work at home. With the pandemic right now, things have changed a little bit. Here's the thing. When you get your credential, right, and you're out applying, you can't apply immediately for remote coding, because then you're going to get either no calls, you're going to get a bunch of rejections. If you apply right now with a place that you have to physically go, like a hospital or doctor's office, 9 times out of 10, they're going to send you home right now, because most employees are at home. Most coders, right? They're at home because of the pandemic, and they want to keep their people safe. Not all places, but most places that you have to physically go, they will send you home right now. All right. I've had 2 viewers who got a job in the middle of the pandemic. First job, first time out, first time right out of the gate. And they're working at home because of the pandemic. But normally, you have to have at least 3 years of experience before you can work at home, because they want to make sure that you know what you're doing. And to have somebody working at home immediately and who's never had experience, it's tough, okay? It's not easy, because you have to learn a bunch of other things too as well. You got to learn how to use the electronic health record, and you got to learn how to use the encoder, and you've got to learn all these other things. So these are things to keep in mind. But you can still get a job right now. Don't let that discourage you, okay? Y'all got that right? You can still get a job right now. But if you are sent home to work right now, just know that it's probably temporary until this thing gets more under control, and then they let everybody back, you know, or they gradually let people back. Okay, so that's it. That's going to wrap up today's show. So I hope this video helps you. Please share it. Did you like already? Have you subscribed to me? So I'm going to wrap it up there. If you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.